Next, we have enuresis. Enuresis is another condition referred to as bedwetting. Is an involuntary urination during sleep. It is common issue in kids and can sometimes occur in adolescents. So unable children will be unable to control their bladder function even they have reached an age where they can control and go do the voiding successfully, right? A child does not have control over this condition. So there are two types. Primary will be wetting occurs in a children that has not fully trained not fully mastered toilet training because of any neurological condition. And the secondary will be wet bedding starts after 6 months of dryness at night. They were doing it very good, but suddenly now they are having it again. And nighttime enuresis is another enuresis, which is nocturnal enuresis. In this, the wet bedding occurs only at night, and the condition common in children, and most children even outgrow wet bedding without interventions. So this is maybe because of the delayed maturation of the CNS system. And before the diagnosis of nighttime enuresis is made, we have to find out any underlying condition, right? Okay, so causes will be genetic cause can happen, bladder issues, hormonal, sleep disorders, stress, anxiety, constipation, medical conditions. So how you will treat this? Encourage them to use regular washroom, fluid management, restricting fluid before bedtime, evening teas and those stuff should be restricted. Bedding alarms, like it will go alarm if they are wetting the bed. Comfort and protection, avoid punishment, bladder training, exercise, dietary conditions. Calendar should be used to record wet and dry nights. So and encourage kids to change their pads after they wet it, so they are trying to control the bladder, right? Involve the children caring for the bed sheets and changing the bed, and the reward system should be used if they are doing it good, but not like before, but after they do it right. So and there is a medication named desmopressin that is used sometime to help with this one. Next, we have bladder exotrophy. So it's a rare congenital condition where bladder is turned inside out and exposed outside the abdomen. Anatomical and functional abnormalities, and it occurs due to developmental effect during the pregnancy, and it's a congenital issue, I would say. So you will see a defect in the abdominal wall bladder, so the bladder will be outside, and the exposed bladder you will see and defect abdominal wall, urinal incontinence, pelvic bone abnormalities, genital abnormalities along with it. So you can find this problem before birth through prenatal ultrasound, physical examination during birth, and x-rays, MRIs can be done to find out the treatment program. So surgical treatment will be done for this condition. Initial closure shortly after the birth to close the bladder and the abdominal wall. Then we will do the reconstructive surgeries to treat another issues like bladder, genital, and later surgeries to improve the bladder control. And the only important thing with this one is that when petroleum jelly should not be applied to bladder mucosa that is exposed outside, because it makes it dry and it will adhere to the bladder mucosa and damage the tissue. So you have to just wet a gauze and keep it sterile gauze, keep it wet, but not that wet, but it should be prevention of the drying out of the bladder outside until they do the surgery.